What if we could integrate ancient wisdom with modern science to tackle cancer more effectively? Today's guest, Pauline Sok, brings that possibility to life. With a master's degree in traditional Chinese medicine and oncology, Pauline combines thousands of years of healing knowledge with cutting edge research to support cancer treatment and prevention. Hi, I'm Debbie Sadie, and welcome back to day 72 of our Proven Cancer Strategies Revealed 90 Days to Cancer Resilience. In today's clip, you'll hear Pauline explain how traditional Chinese medicine, through practices like acupuncture, herbs, and nutrition, can be used alongside conventional treatments to create powerful holistic approach to cancer care. Let's dive into Pauline's fascinating insights on combining Eastern and Western medicine for better health outcomes. Pauline has a Bachelor of Science degree in cognitive neuroscience, as well as acupuncture and traditional Chinese medicine practitioner diplomas. She has completed 3 full-time years of advanced clinical training in traditional Chinese medicine oncology, earning a master's degree from Nanjing University in Chinese medicine in China. Her thesis focused on integrating traditional Chinese medicine into conventional breast cancer treatment. Pauline is the founder and clinical director of Hillgreen Oncology, Acupuncture, and Herbs, which now has 3 locations in Ontario, which is in Canada, for those that aren't in that area. And she uses acupuncture, moxibustion, custom herbal formulas, nutrition, and mindfulness meditation in support of people with cancer and other complex diseases. So, Pauline, if we start out, maybe you could talk a little bit about what traditional Chinese medicine and then the oncology is. Maybe explain a bit of that to our audience.
Sure. So traditional Chinese medicine is its own form, its own system of medicine that's existed for a few thousand years at least. So we have written records going back at least 2,500 to 3,000 years. It sees the body as a microcosm of nature. So basically all the forces present in nature, moisture, dryness, wind, heat, cold, all of that is actually happening in the body. So it's a way of observing. It uses diagnostic methods to observe what's happening inside the body, and then using these natural methods of herbal medicine, acupuncture, nutritional therapy, etc., to rebalance those forces of nature in the body. There's this emphasis on qi, or the energy of the body, and how we can cultivate that ourselves through our food, through even like qigong breathing practices, and through avoiding things that drain us of energy, whether that's environmental toxins in our food, in our environment, whatever it is. So the oncology piece of that, so in traditional Chinese medicine, we have a lot of different subspecialties. There might be traditional Chinese medicine, gynecology specialties, fertility specialists, etc., orthopedics, and oncology is another one of these specialties. So typically in China these days, you'll see that they'll have to do like a 5-year bachelor degree to get the Chinese medicine basics to be even able to practice in any average community clinic. And then typically to go on to focus on oncology or something else, then they'll do like a master's degree at least. So oncology would be one of those subspecialties, and there is a clinical focus on obviously everything having to do with cancer. And then there's a lot of research in that field as well.
Okay. And I know that it's very traditional. You mentioned it goes back thousands of years, but also the field is very modern and evolving. So maybe you could talk a bit about how, there's some of the research and the evolution that's taken place.
Sure. So I'm glad you asked that, because it is a misconception that people think, oh, people came up with this kind of hocus pocus thing to do 3,000 years ago, and for some reason they're still doing it. There is a lot to be said for the traditional methods, and we still employ a lot of those methods, but it's also an evolving tradition that's integrated new knowledge as it's come up, as humans have developed new knowledge about the body through science or even through other traditional medicines. There's been ongoing discussion among frontline clinicians as well as scholars, historians. There's whole universities, huge libraries, and constant professional dialogue talking about advances in Chinese medicine. What is the best way to treat diabetes now, especially in cancer? What about stem cells? How are we going to deal with stem cells? What's the latest research in herbs that would be effective for that, etc.? So in the oncology field, we do have ongoing research and ongoing clinical sharings all the time, like every day, somewhere in China, doctors and academics are meeting and figuring out what's the latest evidence, what are we finding works and doesn't work.
Wow. So really lending a modern twist to a very traditional type of medicine. So that's amazing. So maybe you could talk a little bit about the 4 pillars or factors in cancer development for us.
Sure. This comes out of, again, a theory that is a little more modern within traditional Chinese medicine called cancer toxin. So one of the doctors that was my mentor in China was the direct student of a very well-known national doctor, scholar person who came up with the theory of cancer toxin, which is explanation within Chinese medicine terms as to what, to keep it very simple, there are 4 factors. There needs to be some element of qi deficiency. So that means the qi that we consider to be basically, you can think of it as our immune system in a sense. Basically, our body is made up of yin and yang, which are forms of qi, forms of different types of energy. The positive blood, the positive cells that do the things we want them to do, are physiological tissues, that sort of thing. So this needs to be in a really strong state, but there's some kind of weakness in that qi system that has allowed the cancer to develop. And we know that from the conventional biomedical point of view as well. So if our immune system was strong enough and the cancer was not as aggressive, our immune system would probably be able to eliminate the cancerous cells by itself. But for some reason, that balance has gone out of whack when it has become actual malignant development. So factor 1 is qi deficiency. Factor 2 is that there's some form of stagnation. So not only does there have to be all the nice yin and yang, blood, body fluids, all the good stuff going on in our body, but it needs to be flowing. It needs to be, I don't know if you've seen the acupuncture dolls that have, or the models, they have all those lines all over them with the dots along them. So that's one of our maps of the body. And we think of it as that there's major energy pathways in the body, which is not unusual if you compare it to systems within like yoga or other things like that. Like there needs to be some kind of flow. So in cancer, there is a lack of flow somewhere. There's been stagnation for some reason. That could be due to some external factor, or it could be internal. And you can think of that, if you want an analogy, to almost like blood circulation. There is some kind of hypoxia in a lot of tumorous tissue. Like there's that angiogenesis or development of the blood vessels in the area, but they don't really function normally. And so we think of it as there's a blood stagnation in Chinese medicine. There's also the factor of what we call damp phlegm. You can think of damp phlegm as a kind of, I describe it as an energetic mucus. It can be physical, but it's often considered to be a component of and if you look at how it's described, think of it as analogous to some metabolic dysfunction. So there's something going on with the metabolism that's off.
Pauline's approach shows us that by blending the wisdom of traditional Chinese medicine with modern oncology, we can create a more holistic and effective strategy for dealing with cancer. If you found this clip insightful, please like and share the video. And remember, you can gain access to all 25 expert and survivor interviews by signing up through the link in the description below. Get these life-changing insights delivered daily to your inbox. Thanks for watching, and remember to stay